This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West-Central Montreal.
And welcome inside another edition of the Your Health podcast, available on all your favorite podcast platforms like Google, Apple, iHeart, Spotify, SoundCloud, and more, not to mention CIUSSSWest-Central.ca/podcast. This is special COVID-19 coverage. Glad you could join us. I'm your host, Sean McMahon. We're now weeks into this COVID-19 pandemic with really no clear end in sight, and it's all hands on deck across the board. Every single person across our health network is going above and beyond in their own special way, really just to make sure that every patient and resident across our CIUSSS gets all the care and attention that they need. And given the complexity of the situation and the ever-changing needs, Tung Tran has his hands full. The director of the Mental Health and Addiction Program for CIUSSS West-Central Montreal is my guest on today's edition of the Your Health podcast. Thanks for joining us.
Hi, Sean.
Listen, I'm almost not even sure where to begin because there are so many things to be considered when we talk about mental health, especially at a time like this, right? From CLSCs to inpatients at the Jewish General Hospital and really everything in between. You've got sort of a unique opportunity to have a bit of a bird's eye view of all the potential areas for struggle. So I'm curious, when this pandemic started, where did your focus immediately go, and how has it evolved since that moment?
Well, I would say all services in mental health and psychiatry is affected. So for our inpatient, the first thing we do is we free up beds to anticipate admission without having patient waiting in ED. And the other reason is for safety of patient. For sure, patient will be safer home than to be in the hospital in that pandemic situation. We know that Jewish Hospital, part of the West Central, is designated hospital. So for sure, we want to free up beds. So that was our first concern. And how to make sure too that all the other services is taking care of the patient, including the CLSC, to keep them home and not sending them to the hospital. The other big concern was for my teams who do home visits. This is a real challenge for them because, of course, all the focus was on the hospital. But for my team who do home visit, they need to have all the protection equipment to be able to go to do home visit because some of the people at home might have the COVID and we don't know. So how are we going to make sure that our staff is safe while visiting them and make sure that patient too is safe? Because if one of the staff have symptoms and do the visit, there's a lot of challenge with home visit in mental health. And sometimes our patient reliable, when they say yes or when they say no on the questions that we ask. So I would say this is like what we focus on right away when we start having that pandemic situation.
Constant evolution, trying to find new ways to do things. And listen, I mean, we're all having a bit of a hard time, I think, effectively working from a distance in many cases, just in the general sense of how we're all doing business. But how has telehealth impacted your work and the types of care and follow-up that's being provided right now?
I'm really proud to say that just before the pandemic crisis, the CIUSSS West-Central was really ahead about everything related to telehealth. And in mental health in particularly, we were working already to have telehealth services. So the pandemic just leverage to do it faster. So we have a video conference, we have phone to be able to reach out to patients. So there's a lot of our services that we just adapted to the video conference and phone follow-up.
Fantastic.
So that was something we have the possibility to do really quickly.
And listen, amidst all this, there are staff members who are bearing the brunt of COVID-19. It's stressful. It is exhausting. And it's very possible, I guess, that many feel like they simply don't have time to take care of their own mental health. What are your recommendations for all of our healthcare workers during these really difficult times to just keep taking care of themselves?
Oh, my God. It's true. This is really hard for our staff. And I would say for the population too. And, when we talk about anxiety, well, anxiety is really something you feel when you don't know what's the future, how things going to be. And this is what is happening for our staff. Like, when all this gonna end? So you don't have an answer for that. So that just makes the anxiety just grow. I think one of the most important things for them and for the population is really taking time to connect with their family, with their friends. This is like really something I would like say to everyone. It's so important. I know that, you know, there's a lot of pressure on all of us in the health network, but if we don't take care of ourselves, it's going to be impossible to take care of the population.
I mean, the good news is that CIUSSS West-Central is doing things to help out. There's a crisis counseling hotline for staff. Can you tell me a little bit more about that?
Well, yes, the idea really is to support all the staff for all psychology issues, not only related to the pandemic, because we think a lot about the pandemic, but sometimes there's other like issue. So the idea there is to like really giving psychological support for everything, like the way we do it before, but it just now create more capacity to support psychologically like all the staff.
And in terms of the general public, what do you recommend in terms of resources for the average person who's listening and would like to get help? Because I think, number one, the key, as you said, and I think we all know, but maybe we don't do it well enough, is to talk about it. It's okay to talk about it, to seek out help and speak about these things that you might be feeling or thinking. But, you know, for Monsieur, Madame, tout le monde, general public, where should they go?
If they really need help, they can call 811. We think about 811 always about like info santé.
Right. I got a fever. I need to talk to a nurse. I don't know if I need to go to the doctor. But it's more than that. It's so much deeper than that.
Exactly. Because 811 is info social too. And the info social part, it's really beside right now, but it's still there. So if people need help, they have to call 811, and they are like a triage process to say, okay, this is for like santé, health, and the other part is going to be for social and mental health. And they are doing that already, but you know, if we don't advertise that enough, then people don't know where to go, because right now, the big picture for everyone is 811 for info santé, but we have info social.
It's such a great point. And there are a lot of resources. And for anybody who's looking, of course, CIUSSWestCentral.ca. There's a ton of information there. And you can always call 811, as you mentioned. Listen, I know that this has become an enormous challenge. It was already very complex. Thank you so much for taking the time to do this. Tung Tran, the Director of Mental Health and Addiction for CIUSSS West-Central. Much appreciated. Good luck going forward.
Thank you, Sean. Thank you so much. Have a good day.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at CIUSSWestCentral.ca/podcast or on your favorite podcast platform.